Good afternoon, everyone. We're going to begin. So welcome to the PSC Spring Pre-Retirement Webinar. My name is Felicia Wharton, and I am the treasurer of the PSC. So one thing I know that for retirement, you should not do is procrastinate. So today it's all about planning for retirement. And someone told me that, retirement is life without work, but with financial stability. And this financial stability was won by the union, in which we advocated and fought for equity and fair pay to ensure financial security in retirement. Unions negotiate pension plans into our contracts to ensure that our members can support themselves in retirement. And if you ever read our collective bargaining agreement, that will be found in Article 27. And let's not forget Article 26, which is our welfare benefits. As members of the PSC, we are afforded with health insurance benefits and pensions because our union, the PSC, fought for, maintained, and continue to push for improvements to our benefits as actives and also as retirees when you decide that it is your time to retire. So I'm going to give you an overview of our agenda for today. So after my introduction, you're going to hear from Sandra Zaccanete from the Welfare Fund, and her section is on thinking about retirement. That will be followed by Talene Spelgin from the Cuny Employees Benefit Office. She's going to be talking about retiring from Cuny, the nuts and bolts. Patrick Smith from the Welfare Fund will provide a wealth of information on retirees' welfare fund benefits. We have Debbie Bell, the former executive director of the PSC, and she will discuss why the PSC opposes Medicare Advantage for retirees. And finally, our last presenter is from the Retirees Chapter, which is very active, and I hope you will continue to be a union member by joining the Retirees Chapter. Ann Friedman, the Retirees Chapter Chair, will give you all the information on the Retirees Chapter. And finally, you're going to see me again, and I will be closing out the webinar. So a little bit of housekeeping before I start. If you have any questions, if you look at the bottom of your screen, you will see a Q&A section. That is where you're going to type your questions and they will be answered within the segment. So as we go through the segments, if you have a question based on that segment, drop it into the Q&A and someone will answer that question for you. So again, welcome to the Spring Pre-Retirement Conference. Retirement is freedom, and I'm still an active, but I look forward to retirement in the near future. And we're here to help you on this journey. So I'm going to pass it on to Sandra, where she's going to start her segment. So again, welcome and thank you for showing up. Sandra?
Thank you, Felicia. So as I'm beginning to speak, I just want to share my screen. And my section today is just to talk about the whole aspect of retirement, as you start thinking about it. What you should know is that you need to begin to do your homework early on when you're thinking about retirement, because there are many things to consider. The whole process from the beginning stages of your research to actually retiring can be confusing, since there's a lot of groundwork to cover. It is not a one-stop shop process. There are different people with various expertise that you will need to contact on your path to getting to retirement. And the first point, if you're joining these conferences, that's the first point of beginning your research, because you get a lot of information from these pre-retirement conferences. then you should then start researching about your future Social Security. In general, income replacement, which is the format that we all utilize to make sure that we're able to retire. It's all about, we're not working anymore. Are we able to substitute our income, or do we have enough to substitute our budget, to meet our budget needs? Because sometimes it's not about what we take home. In general, income replacement is approximately 70% from all sources, that being Social Security, private savings, or private public retirement plans. So everyone's need should be assessed within a budget, whether you're doing that with a financial advisor, whether you're doing that with speaking with your retirement company advisors. At your full benefit age with Social Security, you may get roughly 40% replacement rate from Social Security alone. So that's an important figure to consider, because when you start looking at what you're going to get from, let's say you're with TIAA, from your savings, from your retirement plans, from all those places, or if you are getting a pension from TRS, from NICERS, what am I going to get? What's the pension? And when you look at that, and if Social Security is not in the picture yet because you're not taking it yet, because you're young, because you're 62, you're waiting until full retirement age, you're waiting until 70, whatever the case may be, you should be comfortable in knowing what the figures are when you step into that world of retirement. If you were born in 1960, that means you turn 62 in 2022. If you start Social Security at age 62, you will be starting that at a reduced rate. That's early. If you full retirement age with Social Security is 67, that means you were born in 1960 or after that. In 65, if you're 65 in 2022, you were born in 1957, and by looking at this chart, you will see that your normal Social Security retirement age, that means full retirement for you, if you were born in 1957, it's 66 and 6 months. So for a lot of people, they think, oh, I'm 65, I could retire, or I could, collect my Social Security, and that's not the case. So you have to look at what your date of birth, your year, what that is. I encourage everyone, I did this myself, I've been doing this for a long time now with Social Security, to go to ssa.gov, create an account, access with a username and password, and you're able to see your figures. What's good about this website is the level of security, because every time you log in, you have to get a personalized code. So I encourage everyone to go and see the figures from Social Security so that you could begin to do your planning for your future retirement. Another website to explore as you start your research towards retirement is Medicare. So Medicare.gov should be a site that you visit when you are 65 or you're going to be 65 in the near future. And what's important to decipher when you're in this website is what to do in terms of Medicare Part A and Medicare Part B. This is very confusing. I get a lot of emails and phone calls about this. When do I apply for Medicare Part A? I'm not retiring. I am retiring. So Medicare Part A, which is free and is hospital insurance, whether you are retiring or whether you are continuing to work with Cuny, you should be applying for Medicare Part A before your 65th birthday. Medicare Part B, if you are working with Cuny and you have health coverage through Cuny, you should not be applying for Medicare Part B at all until you are going to retire. And this will be a process which is coordinated with your HR office. What's my retirement date? And you will know when to apply for Medicare Part B based on that time frame that you coordinate with your HR office. In the links of folders that you would have received, or if you haven't received it yet, you will receive after this meeting, you will see that there are information resources, and there are some guides in there that I've put together based on your retirement system and based on your age. And so you get guidance there as to what to do for applying for Medicare Part B when you're transitioning into retirement. So again, you're not applying for Medicare Part B, only A, whether you retire or not, if you're turning 65, and Medicare Part B is only when you officially retire. The standard Medicare Part B premiums continue to go up every January. This year, the premium on a monthly basis for someone that gets on Medicare Part B is $170.10. But that is based on your earnings and how you file. So you may be paying more in your total premium when you apply for Medicare Part B. And that total of the standard with that additional premium based on your earnings and how you file is what is called income related monthly adjusted amount, or IRMA. So the Social Security office will be providing to you a letter when you apply for Medicare Part B telling you what your total premium is. So anything over and above the standard premium is your IRMA. When you retire with benefits from Cuny, you never apply for Medicare Part D. Patrick Smith from the Welfare Fund will talk about this in his part, and that's because you get this from the Welfare Fund if you retire with benefits from Cuny. So that's my segue into that. I call it the $1 million question. Day in and day out, I get the question of, when can I walk away from Cuny, retire, and retain my health, my welfare fund benefits, and an added bonus is that those Medicare Part B premiums that you will have to get on when you retire, that's part of the benefits. You will get reimbursed for what you're paying to those, to Medicare for the premiums. So this slide tells you the criteria that you have to meet based on your retirement system. So it is based on whether you are with TIAA, with TRS, or if you stayed with NYSERS in a PSC title. So I'll just briefly go over it. TIA members, you need to be age 62 or older. You need to have 15 years of continuous full-time employment with Cuny. Be in a full-time PSC title with Cuny, and then there is something that you have to do with TIAA, which is start a lifetime income annuity from your TIAA optional retirement plan. In the link of documents that you're going to get about this pre-retirement conference, TIA members will get specific guides about this lifetime income annuity. This is a requirement for your health coverage from the city when you retire. And there are specific things that are relevant only for TIA members in those folders. TRS members, and this also applies to NYSERS members in a PSC title. You could retire from age 55 or older, but your full retirement age to not have a reduction in your pension for life depends on your tier and whether you're 62 or 63 and whether you have 30 years or more. So if you're retiring under age 62 in tier 4 and you have less than 30 years of credited service, you're going to get a pension, but it's going to be reduced for life. You need to have 10 years of credited service with TRS. You need to be in a full-time PSC title with Cuny, and you need to retire from that position and start to receive the pension from the qualified pension plan account. So I get a lot of people and a lot of members that are going to retire. They see my title and everybody calls me. This is a guide of who you need to contact if you are thinking about retirement and you're looking to discuss your financial picture. This is specifically for the financial aspect. What's my pension going to be, or what am I going to get? Can I retire if I'm with TIAA? TI members, you need to meet with your advisor or the TI consultant assigned to your college. There is a list of the consultants assigned to each CUNY college that is provided to you in the folders for all of you with TIAA. They have planning tools with TIAA, where you're able to discuss if you're on track to meet your income goals for retirement. So you should be having those conversations early on, a couple of years before you intend or think that you want to retire. Specifically discussing the CUNY requirement for New York City Health, which is lifetime income from the optional retirement plan account with TIAA. This is something that you will only be discussing when you are a couple of months away from the official retirement date. TRS members, and this also applies to NYSERS members and PSC titles. You need to start looking at your annual benefit statements. TRS goes with the ABS. This statement since 2018 is only provided to you online. No more mailings to your home. So you need to go and log in, go to statements and documents, and you will see your annual benefit statements, which is loaded every fall of every year. You want to look at the qualified pension plan estimate of options page, because in there you will see the figures and projections of what your pension will be on the various options. You also want to look at the TDA estimate of options page if you have that account with TRS or NYSERS. Very important. TRS members, if you do not see estimates on the ABS, TRS needs to obtain service records from your CUNY colleges where you have worked. You need to contact your HR office, request a service record to be sent to TRS. Please provide them with your TRS member number and your tier. Get a copy for your records, and have TRS work on your service so that in the future, you do get to see figures in your annual benefit statements, and so that you do not have problems when you transition into retirement. The thing with TRS and all CUNY members is that the service information and payroll information, it's all a manual process from CUNY to TRS. If you were with DOE as an employee, this wouldn't be an issue, but it is an issue for CUNY. So looking at your total service, looking at your ABS, making sure the figures make sense. If they don't make sense, there's a problem. You should also attend a TRS retirement class on their website. This is the link, and I could also email it to you if you need, you reach out to me. But if you go into their website and you go to the education site, you will always see the upcoming classes listed. I encourage every TRS member to attend those classes. You learn a lot about the pension options and the ins and outs of how it works. If you are with TRS, you will be talking to me, Sandra Zacaneta, before you retire. I am the person that helps you transition from active employment into retirement. I will discuss and guide you on understanding all those retirement options, pension options, and the whole process with TRS. The process, once you decide to retire, official retirement takes place after you have taken your annual leave and or travel leave. Depending on your title, you know what applies to you. I know for a lot of you, you're beginning your leaves, so in your mind, you're retired. I would feel the same way. But official retirement, which is again, a date that is given to you when you coordinate all of this with your human resources office, actually takes place after all the leaves are done. So you want to coordinate that official retirement date with the HR office. If you're in a title that has travel leave, you will obtain your travel leave form from HR. You will have it signed by your chair. You will return it to HR. Before you go on leaves, you have a meeting with your HR officer and obtain all the retiree benefits form. That means health, welfare fund benefits, and so forth. You will discuss all of that, and you will also return all the forms back to the HR office. You want to go to the Social Security office if you are 65 or older. The window opens 3 months before that official retirement date. Again, now when you begin Travia, 3 months before the official retirement date to apply for Medicare Part B. TI members meet your TI advisor, TRS members meet with me, NICERS members, you meet with a counselor at NICERS 3 months before your official retirement date. You want to make sure that you look at the resources, at the folders that were provided to you today, because you have a lot of useful websites. Some of them I referenced today in this presentation. And also you want to make sure that you look at the specific guides. There are Word documents that are in each of those folders. And again, they're retirement and age specific, and therefore it allows you to see from beginning stages to ending stages what it is that you have to do, who do you have to talk to. There's a checklist of the HR documents that you need to get when you retire with benefits from Cuny. When do you apply for Medicare Part B? What to do after you're retired to make sure that you get reimbursed for Medicare Part B premiums. So with that, I am going to stop share. And I see that Talib is here. So I will hand this over to Talib.
Thank you.
You're welcome.
Hi, everybody. Today I'm going to talk about the steps that you take to prepare for retirement. Some of the information you will find that Sandra, some of the information that I'm going to present overlaps with what Sandra presented. So, but I think that it doesn't matter how many times you hear it, it'll help you to recall and remember and emphasize some of the steps that need to be taken. So, so sorry if there's some redundancy here, but you can never learn too much about this. And I think that we'll take questions at the end. And Sandra, you know, the last time you read through the questions and answered them as we went along, and then
I'll do it this time, Tony.
and Patrick will. Okay, thank you, Patrick. Okay, so I'm going to go ahead and share my screen. Can everyone see that?
Yes.
Okay, great. Thank you.
We see presenter view.
Oh,
so we
sorry.
See, yep.
How do I change that?
Click on display settings at the top left.
Oh. Swap presenter and slideshow. Is that it? Okay, good.
There you go. Perfect.
Thank you. Okay, so my name is Talene Spengian. I'm the Director of Benefits in the University Benefits Office at Cuny. Thank you for coming today. These are my agenda items. These are some of the things I'm going to go over. The first, I'm sure that Sandra went over, is language that comes directly from your contract, and it determines your tier and your eligibility for retiree health benefits. So this is contract language that I don't have to go into fully, but it's here if you need it. The one that probably pertains to most people here are appointed on or after September 1, 1985. You're eligible for retiree benefits, retiree health insurance if you are with TIAA CREF and you are separated at age 62 and have over 15 years of pensionable continuous full-time Cuny service, or if you were separated prior to age 62, but you had 15 years of pensionable service and you left Cuny, and came back to claim your retiree health insurance at age 62, as long as you did not work for another higher ed institution in the intervening years. If you are a TRS, NYSERS, or Board of Ed retiree, you must have 10 years of credited service to receive and receive a pension from TRS, NYSERS, or Board of Ed to be eligible for retiree health benefits. I'm not sure if many of you heard recently that the vesting period for TRS, and I apologize if Sandra went over this, but recently what we learned was the vesting period for NYSERS and TRS members was reduced from 10 years to 5 years. However, we did confirm with the Office of Labor Relations that you still need 10 years to be eligible for retiree health.
Correct. I didn't cover it, so thank you, Talene.
Okay, good. So this is a retiree timeline. It's kind of a rule of thumb document. It's not a precise science. Verification of service is something you should do maybe 4 years before retirement if you're planning on utilizing phased retirement, or 6 to 12 months prior to retirement. You should verify your years of service. Sandra already mentioned, sometimes your understanding of when you became a full-time pensionable eligible employee is not consistent with your Cuny records. If you came to Cuny as an adjunct, for example, and you taught as an adjunct for a semester or two before you were appointed as a full-time professor, associate professor, teaching staff, the time that you were adjuncting doesn't count towards your 15 years of pensionable service or your 10 years of pensionable service. So that is you should verify this with your HR office and make sure that your understanding of your years of service is consistent with what is in your official records. Phased retirement, as I said, is 4 years prior, because you apply for phased retirement a year before you actually begin the phasing period. And you can phase for up to 3 years. So that's where the 4 years comes from. Travia leave, you should apply for 4 months prior to the start of Travia. You should contact your pension system 5 months prior to retirement. Again, verify that your understanding of the date that you joined your retirement system is the same as what their record indicates, because employees don't always join a retirement system immediately upon being hired. Sometimes they're hired in a subtitle, and so they haven't joined a pension system, and then they convert to a full-time permanent position. So you should verify this. Apply for Medicare Part A 3 months prior to age 65. Apply for Medicare Part B only when you are planning to retire, which I'm going to talk about in more detail. And then you should meet at least 2 months prior with your HR office. They'll give you all the documents you need, and then help distribute those documents to the various agencies that need to get them. And then if you are participating in a NYSET plan, you should contact NYSET a few months before retirement so that you can discuss what your options are about maintaining your NYSET plans into retirement if you want to. Verification of service, as I said, is when you apply for retirement with your pension system, they will request your service history from the campus that you work at or the campus that you're retiring from. Make sure that the campus is aware of any prior campuses that you worked at so that all of your service is aggregated when it's reported back to TRS, or that all the campuses report back to your pension system so that you get all the service credit that you are entitled to. This is also a good time to look at your work history with the Social Security Administration to make sure that you received credit for all your years of service in which you contributed towards Social Security and paid your taxes. So that is something you should do now to make sure that all your understanding of your service history is consistent with Social Security Administration. So as a Cuny retiree, if you are a member of the optional retirement program with TIAA and you have 15 years of service and you're age 65, you have the option of phased retirement. And what this does is it allows you to phase into retirement by working a reduced workload. This choice, this decision to phase is irrevocable. And once you apply for it and all the approvals are in place, you cannot withdraw from this program and decide to come back to work. Sometimes employees do that when they go on Travia leave, they change their mind, they decide they want to come back to work. If Travia is part, even if your Travia leave is part of your phasing period, it's still irrevocable. You cannot come back to work after that. You should apply for about a year before the fall semester in which you want to begin phasing. As I said, phased retirement is for members of the optional retirement plan who have 15 years of service and have reached the age of 65. What phasing consists of is a work reduction to 50% workload and consistent with that 50% salary while you're phasing. You can phase for 1, 2, or 3 year increments. Phasing has to begin on the first day of the fall semester for faculty. And if you have the option of taking Travia leave in the final semester of your phasing period, in which case your salary will convert back to 100%. For HEO titles, if there's anyone in a HEO title on this call, phased retirement means a workload reduction to 80% and a salary reduced to 80%. You can phase for either 6 months or 1 year, and it does not have to begin on the first day of a semester because your appointment period is not based necessarily on semesters as faculty is. So it's not as rigid as the requirement for faculty to start on the first day of the fall semester. You can start on the first day of June, for example, and phase for 6 months or a year. And again, Travia leave can be the final semester of your phasing period, in which case your salary will bump up back to 100%. So what is Travia leave? Travia leave is the payout of your unused sick leave over a semester or over a 5-month period. If you have the maximum, so Travia leave pays out half of your accrued sick leave. So if you have the maximum 160 days accrued of sick leave for faculty, that means a full semester's pay at a full semester of full pay. And for HEOs, it's 5 months. If you have less than 160 days, then the HR office will have to count how many days, how much of a 5-month period that takes. So it may not be the full 5 months, or it may not be a full semester, because half of 160 days of 80 days is normally not quite a full semester, but if you have the maximum, it's rounded up to a semester. And if you have, and if you're a HEO, it's rounded up to a total of 5 months, even though 80 days may not be precisely 5 months. But if you have less, then you won't get the full, it won't be rounded up to a full 5 months or a full semester. If you take Travia leave in the spring, which is when most people take it, faculty will get their annual leave paid out over the summer after Travia leave, and then that last day in August before the new fall semester begins is what your actual retirement date will be. And up until then, you're still considered an active employee. If you take Travia leave in the fall, then your retirement date is the end of the winter session right before the spring semester starts, and then there's no payout of annual leave over the subsequent summer. So your retirement date is January, usually the 28th or 29th, whatever that last day in January is before the spring semester. So if you participate, if you ever consider donating to the dedicated sick leave program or the catastrophic sick leave bank, you may go back and do the math and think about it so that you're not, so that you don't undercut yourself and fall below the maximum 160 days and then compromise your ability to get an entire semester or entire 5 months paid out. So go back and look at those balances and make sure you have the maximum of 160 days before you consider donating any of it. Travia leave and annual leave. I just spoke about that. If you take Travia leave in the spring, you get paid out annual leave over the subsequent summer, but not if you take Travia in the fall. And then HEOs who take Travia leave will have their unused annual leave paid out before Travia. I understand some of the campuses don't do this. They pay out the annual leave afterwards. And I suspect it's because they think that people will come back after Travia leave. So they don't want their annual leave paid out because they plan to come back, which is not really the way Travia leave is supposed to work. Travia leave is for employees who express a bona fide intent to retire. But because that opportunity is there to change one's mind, very often people do come back after Travia, and that's why they don't get their annual leave paid out until after they actually leave. There is an annual leave cap for lump sum payouts of annual leave, and that's 50 days for executive compensation plan employees, and for HEOs is capped at 45. But this is not how many days you can actually accrue, it's how many days will be paid out in a lump sum when you retire. And for those faculty who are on fellowship leave, you have to be back for 1 year before you can retire. However, if you go on, if you take Travia leave, after you come back and from fellowship and work a semester, you can take Travia leave in the semester after that, and that satisfies this 1 year return to work requirement of those on fellowship leave. So one of the most complicated aspects of retirement is how to coordinate your city health plan with Medicare. When do you apply for it? When do you apply for Part A? When do you apply for Part B? What if you're still working and your spouse is over age 65? Do they apply for Medicare? If you turn 65 and you're still working, what do you do? So there's all these different questions we ask, and it's very confusing. And the easiest way to explain it is, I have found, is to put everything in a chart and explain how to read the chart. So I'm going to switch my screen. I'm going to stop sharing my PowerPoint and figure out how to do, stop sharing. Okay, I'm going to stop sharing that for a second, and I'm going to share the full page of that grid so that you can see it in. Nope, that's not the right one. Sorry. Okay. Do you see the grid?
Yes.
Okay, good. I'm just going to make it so that I can see the full screen and then go through this chart with you. So I'm going to explain how to read this chart so that you never have to ask.
Talene,
I'm sorry, yeah.
You might want to go back. You might want to go back to what you just had, because now it's way smaller on our screen. I'd say rather than going full screen like you just did, go back to what you had and then use the zoom function. I'll show you how to do that once you have it reshared. Okay, we're still in the full screen mode, and
Yeah,
people won't be able
I'm
to-
trying to figure out how to,
If you hover your cursor at the top of the window, then a bar should come up, and if you're on a Mac, just hit the green full screen button once more, or press escape. Try escape.
okay.
There we go. That's gonna be much easier for all of us to read, if it's okay with you.
How's that? Is that too
might-
small or too big?
I think that's perfect there. That's even better if you can muster that.
That's even better? Okay. All right, so I'll just leave it here. All right, so how do we read this chart? The first column is the person, the subject, the person that we're asking the question about. Are we asking about an active employee? Are we asking about the spouse or domestic partner of an active employee who's under age 65? Are we talking about the spouse or domestic partner of an active employee who is over age 65? So once we determine who we're asking the question about, we go to the second column to see what we need to do if the Cuny employee is under 65, and the next column if the Cuny employee is over age 65. So let's go, we'll do a simple exercise. We'll do the first line, and then just to get a feel for how this reads. So in the first column, we're looking at an active employee. So what does an active employee do? If they're under age 65, their primary coverage is a New York City health plan. Medicare is not applicable because they're not age 65 yet. If they're an active employee and they're over age 65, they're still covered as a primary insurer is the New York City health plan, because as long as they're working as an active employee and they have employer provided health insurance, they do not have to apply for Medicare Part B, but they should apply for Medicare Part A because it is free. There's no charge, there's no downside to it, and they should apply for Medicare Part A. Medicare Part B and D is not applicable because as long as they're covered under a city health plan, they are not required to enroll in Part B. And Part D is the drug coverage, which Patrick's going to talk about, which is provided by your welfare system, not necessary to apply for. So now that you have a sense of how to read this, let's do one that's a little more complicated. So let's say we're asking about a domestic partner or spouse who is above age 65, and they're married to a Cuny employee who is still actively working. So if the Cuny employee is under age 65, we look at the second box. So the primary coverage for the spouse or domestic partner is the New York City health plan. The spouse may or should apply for Part A. There's no downside to that. The spouse does not apply for Medicare Part A, for B or D, because they are still enrolled in an active Cuny employee's health plan. And then, but there's one caveat to this. Because the federal government doesn't recognize domestic partners, when the spouse, not the spouse, I'm sorry, if the domestic partner is above age 65, even if they're in a domestic partnership with a Cuny employee who is still actively working, they have to apply for Medicare Part B. If they do not, it is considered a late enrollment and they will be charged a penalty for life. And then Part D is not applicable. So I'm going to say that one more time. If the Cuny employee is actively working and they're in a domestic partnership and the domestic partner reaches age 65, they must apply for Medicare Part B because they are not protected by the employer coverage exemption, the way that a married spouse would be. So the next column would be if the spouse of an active employee is over age 65, but the CUNY employee is also over age 65. What do we do? The primary coverage for the spouse is still the New York City Health Plan and the domestic partner, because the CUNY employee is still working even though they're over age 65. The spouse may apply for Part A. There's no downside to applying for it. The spouse does not have to apply for Part B or Part D, but the domestic partner must enroll in Part A and B. And then Part D is not applicable even for the domestic partner because they are covered under the welfare fund. So I hope that this helped you understand how to read this chart. I'm always available to answer these questions. My email is in the on the first page of the slide presentation, and I'm always available to answer these questions. If your campus HR, your campus benefits officer should always be your first point of contact. But if you have trouble understanding which of these steps to take at any point in time, feel free to contact me. I'm always available to everyone. I'm going to stop sharing my screen and go back to the original slides. Okay, so Ted, is it okay? Let me go back to the full slide. Oh, we don't want to see that display? Is that okay?
Perfect.
Okay, good. All right, so now where was I? Okay, so going back to retiree healthcare, just to reiterate, Medicare Part D, you do not enroll because it's provided by the welfare fund. It used to be that every even numbered years during the transfer period, retirees are able to change their health plans. That's changed now. It seems as though the Office of Labor Relations is allowing retirees to change their health plans on an annual basis. You may be aware that there was a Medicare Advantage plan that was being implemented recently that has been put on hold as a result of some lawsuits by various entities and organizations. The Office of Labor Relations has given me no indication as to which direction they're moving into. And they asked me to just refer everyone to their website for updates. So another benefit for retirees who are enrolled in Medicare Part B is that the cost of Medicare Part B is reimbursed to you, and as well as the cost of Medicare Part B for your spouse or domestic partner. So when you are both retired and have reached the age of 65 and enrolled in Medicare Part A and B, you can apply for a reimbursement. For TIAA retirees, that reimbursement form is sent to my office. I have someone in my office whose sole job is to manage the reimbursements for TIAA participants. If you are a NYSERS, TRS, or Board of Ed retiree, you would fill out the city's reimbursement form and submit it either by mail to this address, the New York City Office of Labor Relations at Cortlandt Street, or upload it at this link to a LEAP file that they set up during COVID when they closed their office and everyone was working remotely. They were receiving all the forms electronically. It seems to have become a more efficient way of doing this. So if you have the skill set and the equipment to scan documents and upload it to this LEAP file, it's really the best way to go about it. As I said, TIA participants would fill out a form and send it to my office. You can mail it, or you can, you can mail it, or you can email it to me. My email address is on the PSC Cuny website. And when I fill the position, I currently have a vacancy. When I fill the position for the role of HR retirement coordinator, that person's name will be posted on the PSC website also with their email, and you can email it to them. Just make sure that you do not email documents with social security numbers on it. In addition to the basic Medicare reimbursement, there's also something called an Irma premium, and all retirees pay the Medicare basic premium, but Irma is income related. And so for certain retirees whose income exceeds a certain threshold, they may be subject to an additional Medicare premium. But this premium is also reimbursable to you. And except that the way to apply for it differs somewhat. So the basic reimbursement for TIA participants comes to my office, but the Irma goes to the New York City Office of Labor Relations, and it's uploaded to that same LEAP file as you would submit for your basic reimbursement if you're with TRS. Once you apply for the basic reimbursement, you'll automatically get that every year. But because the Irma premium is subject to your income, and which can change from one year to the next, you're required to apply for the Irma reimbursement on an annual basis. So you have to apply every year that you are subject to Irma, you have to apply annually for that reimbursement. If you are a TRS member, your Medicare reimbursement is directly deposited into the bank account in which you receive your pension. But for TIA participants, that is not the case. You will receive a check in the mail. One of the things you should consider as you get closer to retirement is the money that you contribute to your transit benefit. At the time that you separate from Cuny, you have 90 days to spend down whatever funds are in that account. Otherwise, you forfeit them. This is an IRS governed program. And because your contributions to this benefit are made on a pre-tax basis, you cannot receive a refund if you don't spend all the funds that are contributed to this fund. You will lose it if you don't spend it after 90 days from separation. So what that means is separation means when you stop receiving a paycheck from Cuny. So if you're on Travia leave, you're still receiving a paycheck. When you're having your annual leave paid out to you, you're still receiving a paycheck. So the 90-day clock starts when you stop receiving a check from Cuny. Usually that's for faculty. Usually that's the end of August before the fall semester begins, which is your official retirement date. That's when the 90-day clock starts from. So from that point on, you have 90 days to spend down those funds. We have a lot of people who do not understand how this program works, and they have $1,000 accumulated in this account because they don't realize they're supposed to be using it to purchase their MTA tickets or their bus tickets. So find out what your balance is and make sure that you have enough time to spend down those funds. Otherwise, you will lose it. Especially if you are eligible for discounts, senior citizen discounts on your transit ticket purchases. So it may take even longer for you to spend down that money if you're contributing too much and you're not spending enough. The healthcare flex spending account functions in the same way. It's because it's pre-tax dollars. You have a 90-day period from retirement to spend down those funds. So make sure that you know what your balances are and make sure you spend down those funds and get your reimbursements before that 90-day clock closes out. The New York State Deferred Compensation Plan is an additional investment option for CUNY employees. It's available to everyone. If you are maxing out on your tax deferred annuity contributions, either with TRS or with TIAA, this is an additional investment option for you that you can max out as well. So even if you are a year or two away from retirement, this is an opportunity for you to max out on this plan if you're already maxing out on your another TDA. If you are not already, I just had a defined compensation presenter presented the pre-retirement seminars that I conducted a few weeks ago. If you need to contact them, I can give you their contact information and you can reach out to them. Enrollment is done on their website because they communicate through file sharing with the payroll systems. So you don't have to get your human resources involved in it. It's automatic if you sign up on their website. Retiree Counseling, Sandra already talked about this. You should contact Sandra. You should contact your pension systems and attend the trainings and seminars that they're conducting so that you fully understand what your options are with regard to retirement. And your human resources office also is a good resource for you and can guide you and help you figure out how to sign up for these events. Working after retirement. If you're collecting a pension and you're under age 65, or you're collecting a lifetime annuity with TIAA, there's an earnings limitation. You're not supposed to be earning money and retired at the same time receiving a pension. So there's an earnings limit. If you're under age 65, you can't earn more than $35,000. That's the limit in 2022. This only applies if you are under age 65 and you go back to work for a New York State or New York City agency. If you are over age 65, this limit doesn't apply. And if you go to work for the private sector, it doesn't apply. I don't know if any of you have heard, we recently learned that this 35,000 earnings limit was waived. It's been lifted for New York State and New York City agencies for employees. However, we also learned that that waiver does not apply to CUNY employees. So this earnings limitation is still in place for CUNY employees. One of the things that we find with retirees is that when they move, they don't let us know about it. When their bank account changes, they don't let us know about it. These are, and unfortunately, all these different agencies and offices don't really share information with each other. So even if you're in retirement, feel free to update your address with your college human resources office, with with your pension system, the welfare fund, our office, if you're receiving a TIAA, if you're with TIAA and you're receiving a Medicare Part B reimbursement, very often retirees move and they don't let us know. Also, if you have bank account changes, you should inform the Office of Labor Relations or your pension system. And as well, if you have life event changes such as marriage, death, divorce, adoption, as your beneficiaries change, make sure that you notify TIAA, make sure you notify your pension system of those kinds of life event changes. Your marital status, if you're receiving a Medicare Part B reimbursement and you are divorced, your spouse is no longer eligible, or your ex-spouse is no longer eligible for that reimbursement, and they're no longer eligible to be on your health insurance plan. So make sure everyone is aware of these life event changes. And these are just some links to commonly used websites that you might find pertinent to you. And now is the time for questions. So I'm going to stop sharing my screen so that I can see the questions. And it looks like there's a handful of them. How do you?
I'll read them out to you.
Okay, good.
Okay. How do you enroll into 457B as an additional option? Does that make sense?
Let me,
Sandra?
I think they need to specify because 457B is for investing. So I don't know what the question is in terms of retirement.
Okay.
So maybe they
Laxman,
could
if you
type.
can be more specific, Laxman, we'll try and answer your question. We're going to move on. Can you-
the enrollment for the 457B plan is done online. So if you go to the benefits website, on the Cuny benefits website, there's a site for the 457 plan, and it'll link to their website, and that's where you do the enrollment.
Okay. Next question. Can you retire and defer receiving a pension? I don't think so. Not and get benefits.
If you are with TRS, you can apply for retirement. You don't have to apply for a pension right away, but then you're not eligible for retiree health.
Mhm.
Right, that's the answer. Philip says, does this 80%, I think he's responding to my
Talking about
question.
phase
Yeah,
retirement.
Medicare covers 80% of medical and hospital costs. So whatever you choose as a supplemental plan, that supplemental plan picks up the 20% that Medicare doesn't cover of medical and hospital costs. And we're not talking about Part D here. I'm sorry, Talene, go ahead.
No, I just wanted to clarify that that coordination of benefits where the health insurance plan pays the 20%, that only pertains to the GHI senior care plan. So regardless of where you live in the country, nationally, you know, there's a misperception that you have to go to a doctor that accepts GHI. When your GHI senior care plan is coordinated with Medicare, it does not, you don't have to go to a GHI participating network participating physician. It's a special coordination of benefits in which if you go to a Medicare doctor, Medicare will pay the 80% and the GHI senior care plan will pay the 20%.
Okay. When does Cuny need the Medicare reimbursement form? So there are two forms. To get into the system for standard Medicare reimbursement, that's just the standard monthly cost that everybody pays. That form is included with your health benefit, retiree health benefit enrollment forms that are given to you by your campus benefits officer before you retire. That gets you into the system for the standard reimbursement. The IRMA, if you are what Social Security considers a higher income retiree and you get charged extra, and that is called the income related monthly adjustment amount, that you apply for the year after you are charged it, and you must apply for that IRMA reimbursement every year. But the standard reimbursement form is part of your retiree health insurance packet of things you fill out that you get from your campus benefits officer. You fill that out and it's one and done. You're in the system, you'll get the annual reimbursement. Beryl says, can we get Talene's PowerPoint?
I'd love to share. You have it.
Yes.
You guys have it. So if you want to send it out to everyone, all the attendees, by all means. There's also one that's almost identical that I use when I do pre-retirement seminars, and that's on our website too. And by the way, I just wanted to also add, there's a recording of our pre-retirement seminar. There's a link if somebody wants to go listen to it. It's fascinating, I think. I'm fascinating. But it's there's a link to one. I wasn't able to I wasn't able to record the most recent one, but there's one from 2020 and not much has changed since. And there's also one for with TRS And there's also one for pension and retirement with TIAA. So there are 3 recordings that people can go back and listen to if they want to.
And I
be-
believe this one is going to be available for distribution
Okay.
too.
So,
Just the
okay,
recording, yes.
Yeah.
okay.
There's another
Lisa-
question, yeah.
Yeah, Lisa says, can I retire at 55 years old if I have 20 years of service and there's a early retirement package in late 2022 or 2023? If so, will I be eligible for retiree health benefits? Does that make any sense?
Everyone asks about early retirement.
Yeah.
Until there is one that is passed and the parameters are clearly stated, it's hard for us to answer that kind of a hypothetical question.
Mhm.
Okay. Bob says, can you share the address of the website where the recordings you referred to are living?
Yes, I'll put it in the chat if you want.
Okay. All right. Edward says he's on diabetic meds and he has questions about how this will be covered. So Edward, I'll talk about this in a little more detail when I present. Short answer is, if you're on diabetic meds now and you are filling your prescriptions with your basic health insurance company, when you become Medicare eligible, then you'll be enrolled in the Welfare Fund SilverScript Medicare Part D plan, and your insulin will be covered by that plan. Talene is, they're asking about the website for the PowerPoint. She's sharing that website in the chat. Maria says, what is the best way to actually speak to a TRS person? Their phones are always tied up and no one returns calls. Can someone walk in to one of their offices?
No. So TRS is only seeing individuals that have an appointment, and what they do is limited. Your best course of action is to reach out to me. My email, I'll put it again on the Q&A section, szacaneta@pscunywf.org. I'm Sandra Zacaneta. Also on our website at the Welfare Fund, under the contact section, I'm listed there. We're all listed there. So you can find my phone and email. Email is the best way to contact me. And let's communicate about what it is that you want or need. I am basically the in-between between TRS and all of you with TRS. So that's probably the best way to go about getting some answers, because yeah, the phone center, you'll be on hold for a long time.
Folks, if you've got any other questions, please type them in. Otherwise, right now we've covered our questions. Oh, wait, sorry. Rhonda says, right now, my husband and I both work for the city. I'm covered under his health plan. He's retiring in January 2023, and he's going on Medicare. He's drawing Social Security. I'm retiring in January too, but I'm not qualified for Medicare. Well, this is the thing. You can be enrolled in Medicare if you're not collecting your Social Security, Rhonda. You get billed directly for that. If you're Medicare eligible, you don't have to draw your Social Security. You'll get direct billed by Medicare for the premiums. So I hope that answers your question. Not drawing Social Security doesn't prevent you from enrolling in Medicare.
Are you asking me? No, you can enroll in Medicare without.
Yeah, no, I'm
You just-
answering Rhonda's question.
Oh,
here. I
okay.
think that's the answer, yeah. Anybody else? Okay, let's see. Maria says, I think I misunderstood. Is adjunct work included in TRS pensions. Adjuncts are eligible for the TRS pension system, yes.
I think if the question is
Do they get service credit for?
credit, yes. So
I
if
think they would, yeah, go ahead.
they are. So if you are an adjunct and you sort out your service, again, reach out to me, TRS. If you sort out your service, that counts. Also transferred service from other retirement system, all of that counts. And if you ended up in a full-time title, that counts towards your meeting the criteria of 10 years or more for the health and welfare fund benefits. It's
But
different.
you
for-
may have to buy back time, because if you worked as an adjunct, you didn't join TRS right away.
Right. So you could buy back the time. Some adjuncts, do join voluntarily. And if they transition into a full-time title, that time is going to count. Okay.
But it does
Um,
not for TIAA.
It does not for TIA.
So can you look at the last question at the bottom? I'm not sure what they're asking. I will attach. I am TRS. They sent me the papers. I'll attach those papers to the form in the TRS website and request to buy back time. Is that the correct thing to do?
Yes. So reach out to me and then I'll guide you on, the next steps and the form that you have to do with TRS and all of that.
Right. And then this person adds, my time at NYU is not CUNY time, but are you saying that when I join TIAA, I can buy back time in TRS?
No, TIA you cannot buy back. It's only TRS or NICERS.
TRS and TIAA time do not get combined.
Mhm. I think pretty much everything has been, I'll continue to manage the Q&A. So I think you could go, Patrick.
Okay, great. So, hi, everybody. I'm Pat Smith at the Welfare Fund Communications Director. We are a small staff, so we all do lots and lots of stuff. Often, if you have questions about your retiree health benefits per se and not pensions, you can ask me. And we save Sandra some time and allow her to focus on pension and TIAA issues. I'm going to share my presentation Anna East, just to let you know, I'm going to be less than a half an hour. So it's probably more like 20, 25 minutes max.
Thank you. Yeah, because we're just a little before schedule, so I wanted to make sure.
Okay. All right.
Thanks.
So everybody see this, I hope. This is us, happy retirees. That's me, a future retiree there, but it won't be long. So what is the PSC CUNY Welfare Fund? These are supplemental health benefits, and that means the benefits that are not your basic health insurance from the city of New York. They're not Medicare. They're not your Medicare supplemental plan. We service active employees and retirees, important to know. Retiree benefits are on a par with active employee benefits, and that's always been important for the PSC, and so that is the fact. We are a very, very small staff. That's why we all do a lot of different stuff. Here's the pie chart showing basically how the money is spent, and you'll see the biggest chunk of the pie is prescription drugs, and the costs of prescription drugs, as I'm sure you're aware, continues to go up, and so we got to manage that very carefully. So let's talk about prescription drugs. If you are Medicare eligible, you will be enrolled. We will enroll you in our SilverScript Medicare Part D drug plan. So if as an employee, you are receiving injectable or chemo drugs, not from the welfare fund, but from the New York City PICA program, which covers injectable and chemo. Once you are a Medicare eligible retiree, you'll get that from the SilverScript Medicare Part D plan. And the same goes for diabetic drugs. As an employee, those drugs come to you from your basic health insurance plan by state law. They're not covered by the welfare fund. But when you retire as a Medicare eligible retiree, diabetic medications are covered by the welfare fund SilverScript Medicare Part D plan. When you are signing up for Medicare, you sign up for Part A and Part B. A is hospital, and maybe you may have signed up for that already as an employee turning 65. You won't use it as an employee, but it gets you into the Medicare system and there is no charge. Do not sign up for a Part D drug plan. If you do, it causes trouble. You'll have to drop that plan, and then we'll enroll you in the welfare fund SilverScript Medicare Part D prescription plan. The enrollment forms for our Part D plan are included in those retiree benefit enrollment packets that you get from your campus benefits officer. Most welfare fund benefits do not change upon retirement. Your dental plan, either Guardian or Delta, goes forward. The Davis Vision benefit, free eyeglasses if you choose the Davis Vision frames, that goes forward. The really good Hear USA hearing aid benefits, $3,000 off the cost of hearing aids, goes forward. And if you know that your hearing is beginning to erode a bit, don't hesitate, don't wait. There's no stigma in wearing hearing aids, and they're much better than they used to be. So really do take advantage of this Hear USA hearing aid benefit. It is a spectacular deal. Many hearing aids are available that actually have no cost to you. Some welfare fund benefits do end at retirement. Disability, for one, that is employee income replacement. If you're unable to do your job, but you're not eligible for retirement or you don't want to retire, that's what disability is. When you retire, that goes away. The death benefit for your survivors, $5,000 for your survivors if you die in service, that goes away. If you have GHI CBP as your basic health plan as a retiree, as an employee, the extended medical benefit will partially reimburse costs that are incurred if you need to use non-GHI doctors. But when you enroll in Medicare as a Medicare eligible retiree, that goes away. Of course, if you retire and you are not yet 65, that extended medical lives on because you're still in GHI CBP until you turn 65. This is my most important slide. This is the one that people often forget. If you are paying for stuff, that is health insurance policies and related things, by payroll deduction as an employee, before you retire, you need to contact each of those insurers and let them know that you're retiring, because the first bill after you go off payroll has to be a paper invoice sent to your home. So you're going to call up Mercer Consumer, the administrator of the catastrophe major medical plan, and let them know what your last payroll date is and that you need to be billed at home for the next premium payment. Generally during the second billing cycle for that catastrophe plan, You will be able to arrange for automatic deduction from your pension, from a TIAA account, from your bank account. You got a lot of options there. But the first bill for these things, once you go off payroll, has to be a paper invoice sent to your home. So in some cases, people have purchased this catastrophe major medical plan 30 years ago, 35, 40 years ago. They may have moved several times. You want to make sure that the plan administrator has your current home address. So when the bill comes, you pay it, there'll be no lapse. And like I said, during the second billing cycle, you can arrange for deduction from wherever you want. How do you contact us? Here's our phone number. Phone number stays the same for employees or retirees. This email address, communications@pscunywelfarefund.org, that's me, or one of my email addresses. So when in doubt, you can write to me there. And I will answer your email or send it along to the appropriate person. And please do visit our website, especially as retirees. It's where you can get links to all of the benefit vendors' sites, phone numbers for all the benefit vendors. If you lose your SilverScript drug card, you lose your Guardian dental card, all the phone numbers for getting replacement cards is on that website. Applications, claim forms, and lots of extra information is available on our website. If you haven't been there, please do visit it. It's a very, very useful site, and we are upgrading it as we speak. It's going to be even better. It's going to look more or less the same as this. We're keeping our architecture, but we are upgrading it. So please do visit the Welfare Fund site. And I'm going to stop sharing, and let's take some questions.
Okay, so there is one question. After retirement date, when do you get the SilverScript card?
It comes pretty much immediately. I would say, if you you get all your forms in, you'll have it before you retire.
Right. Currently, some RX is processed and paid by Express Scripts. What happens to those medications in retirement? Does the welfare fund pay for these?
If you're using Express Scripts now, that would either be for the New York City PICA program, or that would be for things you are using your basic health insurance. In both those instances, those drugs will be covered by the Welfare Fund SilverScript plan.
I think this question is maybe for Talene. I don't know if you get to read it, Pat. Rhonda talking about the hip emblem.
I think we talked about this already.
Okay.
I think Rhonda, the crux of Rhonda's question is, she's not going to be collecting her Social Security, and she thinks that's going to keep her from enrolling in Medicare, and that's just not the case. You don't have to be drawing your Social Security to enroll in Medicare when you turn 65. They bill you directly. You'll get a bill from Medicare sent to your home. So you do not need to enroll in social, collect your Social Security to enroll in Medicare.
If I continue to work after 67, am I still covered by the welfare fund?
Sure, you're covered by the welfare fund as long as you're employed and into retirement, if you retire with
benefits.
Eligibility.
Mm-hmm. Are retired faculty permitted to return? Okay, I'll answer that. About how would prescription drugs be handled if a retiree spends extensive time outside the United States, approximately 3 months annually?
You can't fill your prescriptions outside of the United States. So That's just the fact. You may be able to, when you come home, get a 3-month supply. Certainly that's possible. You can get a 3-month supply to use when you're traveling.
Are the dental and vision benefits nationally, or they do only apply to New York State providers?
They are national. The networks are national. Davis Vision is national. Guardian is national. Delta Dental is national. So you can use them all over the United States. And then you can go outside of the plan, but the coverage is limited. If you don't use our providers for Davis Vision, for instance, you can get reimbursed up to $200 a year. You submit for direct reimbursement. Guardian, if you go outside the plan, the welfare fund does contribute to the cost of some of those services, but not as much as if you are inside the plan. You always get more bang for your buck if you use our contracted providers.
How are prescriptions currently filled under Caremark transferred to Silver Scripts?
Oh, it's a simple process. It's the same company, by the way, so it's not an issue.
Okay, I wanted to address Bob Sasha, who asked, I think you probably missed the earlier part of where we were talking about eligibility for retiring with benefits. He mentions he's TIAA. TIA members need to be age 62, have 15 years of full-time continuous service, and retire from the full-time title to get the benefits that Patrick talked about from the welfare fund and also health. I think that's it. I'll answer the TRS question here. I don't see anything else. When should we contact OLR during Travia? You don't contact OLR during Travia. OLR, if you're talking about reimbursements, you will do that once you have your Medicare Part A and B card with you. You apply to Medicare, you have it, and then you could proceed with applying for the reimbursements. And how you get the form depends on the retirement system that you have, and that's something that HR discusses with you and provides to you.
Can I just add something?
Yes.
Your HR office and benefits officer should always be your first point of contact.
Right.
If they don't have the full answer, that's where you should go. They are your best guide. They know this inside and out. And if they don't know the answer of your very nuanced question, they will get it from the subject matter expert. HR benefits is always your first point of contact.
Right. And then this one last question, I think, before we go to Debbie Bell. If you have a plan to travel for a month and your medication stock is for 10 days, can you have medications for a month advanced, diabetic and cholesterol medication? Pat?
Yeah, you can get a 30-day supply. And I mean, if it's a maintenance medication, you can get a 90-day supply.
Okay. There's a suggestion in the Q&A, Pat. You could read that. We'll leave it up to Debbie Bell at this point to transition into her part of the agenda. Hi.
Hello, everyone. I'm Debbie Bell. I'm the former executive director of PSC. I have gone through the process of retiring from Cuny with my husband, who is a retired Cuny professor. And I just want to second what Talene said about the college HR office being your first point of contact. And then I want to add that there is an enormous amount of paperwork involved in retiring. It's not easy. Give yourself some time, plan ahead of time to be in communication with your pension plan and with your college HR office, and be patient with yourself as you proceed. That said, I was asked to talk about changes that are upcoming, likely, perhaps not for sure, in retiree healthcare coverage. If you are planning to retire between now and December 31st of 2022, you are eligible for health insurance as a retiree, your health insurance options will be what they have been for a number of years, and what the college HR offices have been talking to you about, and probably what Talene, I missed her presentation, but I've heard it in prior years, what Talene was discussing as options. Over the past year, the City of New York proposed a new retiree health insurance plan called Medicare Advantage Plus. This is the plan that the city intends to implement as the premium-free plan. Senior Care, which is a plan that applies to Medicare recipients, it's a supplemental health insurance plan to Medicare, will continue under their concept. But those who opt to stay in senior care will have to pay a premium every month. Now, let me take a step back. The city developed this proposal last year, and it applies not just to Cuny employees, but to all the city agency retirees who are 65 or older and therefore eligible for Medicare. If you're under 65, you continue and retire, you continue in the active employees health plan options. Medicare Advantage is a concept that's been kicking around for the past 20-some years. It is a tool for privatizing Medicare. It is a tool, arguably, for narrowing the benefits of Medicare, because what it does is, rather than traditional Medicare overseeing your medical provider bills and paying them, instead it hands the whole job over to an insurance company that runs the entire plan, so that they cover the Medicare portion of your plan and the supplemental portion of your plan. Retirees in New York City objected to this strenuously. There were, and this is one reason that you, when you retire, should consider becoming active in the Retirees Chapter. The PSC Retirees Chapter and retiree chapters around the city from all the different unions, DC 37, UFT, the Uniformed Forces, have organized and protested this move by the City of New York. A lawsuit was filed, and a judge found, and I'm now simplifying his ruling, so don't hold me word for word to it, but the judge found that the city and the plan had provided insufficient information to ensure that retirees who were enrolled in this new premium-free plan knew what they were getting into and could be assured that they would continue to have the doctors and other providers that they had traditionally had under Medicare. The city, and therefore that the city could not implement the plan. It had been scheduled for January of 22, then it was scheduled for April of 22. It is now on hold because the city has appealed the judge's ruling. The other part of his ruling was that the premium that the city intended to charge to over 65 retirees who wanted to stay in senior care, that is, stay with traditional Medicare and stay with the GHI-like senior care plan that that is the supplemental plan, and for which the city was saying retirees would have to pay a premium, that the premium that they were charging was way too much. It was out of line with what the administrative code said the city could charge. Technical issue, I won't bore you with that, but the city appealed this ruling. The appeal is being heard in the fall. There will presumably be a decision later in the fall. Whoever wins or loses may in turn appeal. So it may be a while before this plan is implemented. But as you prepare for retirement, the PSC wants you to be aware that this is coming down the road in one form or another eventually. And that the way retiree health insurance for those on Medicare has worked in the past likely will not be the same in future years. Again, no dates, no specifics yet. We're fighting. And the PSC has been an important leader in that fight, the Retirees Chapter. The significance of healthcare for retired city employees cannot be overemphasized. And the fact that most retirees have been satisfied with the arrangement whereby they are under traditional Medicare and then under GHI-like senior care for their supplemental benefit, to supplement Medicare. Medicare pays 80%, senior care pays 20%. The fact that people have been satisfied makes it particularly important that we work very hard to retain this relationship. On a 10,000-foot level, Medicare Advantage, as I said in the beginning, is privatizing Medicare. That's going the opposite direction than the PSC's traditional political position in favor of single payer or Medicare for all. So on a sort of political level, there is opposition to this, but on a practical level, there is opposition as well. And the Retiree Chapter has been very strong in its opposition. Where am I going with this? Pay attention to what is going on with retiree healthcare. Pay attention to what is going on with healthcare generally. Healthcare costs have gone up and up and up, and employers, including the city of New York, are seeking to control those costs. And they are unfortunately buying into private sector schemes to supposedly make it cheaper, but in fact may end up constraining the benefits that we have traditionally enjoyed as city employees and as city retirees. The Retiree Chapter holds monthly meetings, as Anne will talk about. That has been an important forum for information for retired PSC members. It will continue to be. We have used the Clarion newspaper to inform people. The retiree newsletter keeps people informed and has a very active web page on health benefits. The final point I want to make for those of you who are in TIAA, and this is something that many of us didn't fully understand, is that because you do not receive, once you retire and you are in TIA, it's not a defined benefit plan. You don't receive a benefit check every month the way people in TRS do. That has a couple of implications. One is when you retire, you will be told to set aside a certain amount that's in your TIAA account in an annuity for healthcare. The reason that exists is for those of you in TIAA, that is your pension, that amount that you have to set aside that enables you to be eligible for citywide retiree health benefits. Many people I know that I've worked with, and I'm sure that Sandra has worked with, said, I don't want to set aside any money from my TIAA account. This is what setting aside this money is what gives you a pension and therefore makes you eligible for the city health benefits. So go with it, and you know, that's an important thing to understand. Second is, if you are in TIAA, because you don't receive a monthly benefit check, if and when you opt for a retiree health plan, a Medicare supplemental health plan, that's people over 65, you have to pay a premium, as you do now under some of the health plans. That premium either comes out of that annuity, or you may be billed directly by the health insurance company that's providing your benefits. So again, it's all complicated. You've heard a lot of information today, so I don't want to overload you, but just be prepared, pay attention, keep your paperwork, keep everything that comes from Social Security, keep everything that comes from Medicare. Eventually, you'll want to use it. And above all, be an activist on your own behalf and on everybody else's behalf. And with that, I want to pass the baton to the new chair of the Retirees Chapter. And that chapter has played such an important role in the fight against Medicare Advantage in New York City. Ann Friedman.
Wait,
Thanks very much.
Debbie, there's a question. There's a question for you.
Okay.
Pat, you want to ask? You're muted, Pat. You're muted.
Yeah, I got it. Audrey is, I think, anxious that people might automatically be forced into the Advantage plan. She's using this term grandfathered, Debbie. She's saying, might retirees in traditional Medicare be grandfathered? It's not really the term.
Well,
might they be forced into the Advantage plan if it's implemented?
The way the city set it up is that no one will be forced into anything, but this is why you have to pay attention. The way the city originally set it up is that retirees will be automatically enrolled in Medicare Advantage Plus, which is the name of their plan, unless they formally fill out some paperwork to opt out of it and select a different plan. So it's not grandfathered, but there is an automatic enrollment issue. The retiree chapter and the union will be on top of this once we know that A, the city is going to implement this, and B, the dates when it's going to happen. We will be flooding retirees with information, and we will also be, I assume, running articles in Clarion so that even active employees know what's going on. And this was one of the processes, I think, one of the reasons the judge ruled the way he did, because while there were thousands of retirees who objected to what was happening, there are hundreds of thousands of New York City employees out there in the United States, many of whom probably didn't know what was going on and therefore might have been automatically enrolled in this new plan because it's premium free. But the judge insisted that there be a time frame whereby people who find themselves automatically enrolled can pull back from it and opt, if they didn't opt out previously, opt into a different plan. So I am pretty sure that whatever the city does in the future, they will have to offer you some escape hatches, if you will, and certainly will provide the time to opt for a different plan. I hope that was clear.
Any other questions, folks? I think
now I'll
you've
get it.
battered them into insensibility, Debbie.
Right. That's what this does. That's the problem. So now let me turn it over to Ann Friedman, the new retiree chapter chair. And again, encourage you once you retire to join the chapter. Thank you.
Hello, everybody. Well, Debbie is certainly a great advertisement for the retiree chapter. And my main purpose today is to welcome you to join us and encourage you to join us and tell you the kinds of things that we have to offer. Actually, this is my first public appearance as the new incoming chapter chair of the retiree chapter of the union. And I'm privileged to spend that time with you. Just as an aside, I am also the first woman chapter chair in the history of the retiree chapter. And I'm very proud of that. And I really look forward to meeting you all, hopefully one day in person and not on Zoom, and for you to help us do our work and enjoy working with us. You've heard a lot of information today. I think aside from Felicia, I may be the only faculty person or faculty person emerita speaking with you today. And so I have been through the process that you are at whatever stage you are at now in terms of planning for your retirement. You may be very close. This may be your first time dipping your waters into all these many, many faceted angles and things that you need to be aware of and choices and decisions that you need to make. And I know that when I was on, well, I thought I was on the cusp of retirement, but it took me a few more years. I attended a number of these sessions, and it does take time to make these decisions. And so, as I think Debbie said, you should, I don't know if she said be gentle with yourself. She said be patient with yourself. In addition to looking forward to retirement, which is a very heady and exciting time of life, I think this, for many of us, comes with a certain amount of trepidation. It's a major change. I had worked for, well, I'm not going to tell you how many years, you'll figure out how old I am, but I had my career mostly in Cuny, but not only in Cuny, as an educator, basically took up the major portion of my life for most of my adult life. And in addition to all those other important things like family and friends and all those things that are very, very important to us. So it's a major, major change. And I actually thought that I was super ready to close the book on teaching and close the book on meetings and close the book on dealing with my college president and the chancellery and getting up every morning and, getting ready to go into the classroom and all. But I was pretty prepared. I think one of the things that I don't think, this is anything new to you, it's good to have some kind of plan or forecast for how you might transition and begin to use some of that time, because the biggest treat about retirement is time, and it becomes your own time. You don't get up and punch a clock. For me, that was a gift. I very much enjoyed not having to answer to anyone else, and not having to be in class at a certain time or being in an office at a certain time. But I did find that I was a bit at my wit's end after a certain point. And I think obviously having plans, whether it's you plan to spend more time with your family, your friends, traveling, hobbies. For me, it became my artwork, becoming proficient in a language and learning a new instrument. I've actually fulfilled 2 of those goals, but not the third, and I'm retired over 6 years. I mean, that really helps to give some structure. But the best way to stay anchored in your pre-retirement life and your post-retirement life is to be part of the retiree chapter. And we're a very different kind of a chapter. We are cross-institutional and cross-title. So we are almost 3,000 members, and we are made up of full-time and part-time faculty, HEOs, CLTs, every department you can imagine, every division you can imagine, every college you can imagine. And so it becomes an opportunity to remain connected with some people who you may already know, but to develop new relationships and new connections with others from across the university. Now, as you look ahead, and once you are officially retired, you can join the retirees chapter. It's a real bargain. It's, I think it's still $80 a year for full-timers and $40 for part-timers. And we provide opportunities for many, many activities. We meet monthly. We have speakers on all different kinds of topics, on political topics, on cultural topics. We go to baseball games. We have book groups. We take walking tours. We have a writing circle. People are involved in social safety net and environmental justice activities, anti-racism activities, and the possibilities are really almost endless. When we are able to meet in person, we have in January and in June, we have luncheons with good food and wine. At least we did when we used to have those get-togethers. And those were really highlights for people, I think, and very well attended. So hopefully we'll be able to continue those. What else? As Debbie said, a very important part of maintaining your membership in our chapter, I think has really been highlighted over this past year as we have struggled in this healthcare fight that may seem very overwhelming for you to hear about for the first time, but our retiree chapter has been instrumental in seeding this kind of David against Goliath battle where, we are trying to maintain for us, the best possible benefits that we can. And we've led that fight in many ways. We've joined with retirees across, not just the university, but retirees across the city in fighting this battle. And we've had monthly meetings, informational meetings. People can ask questions. We maintain websites. Of course, we have a retiree website. We have a special website updating you on the healthcare issues. And this is really important for you to pay attention to so that you can get correct information, but also hopefully so that you can join us in some way in these struggles. The PSC, a retiree chapter, also participates in many of the campaigns that our in-service union colleagues participate in. We lobby in Albany, we lobby at the City Hall, we attend demonstrations, we write letters, and in a way, we can really augment the forces of our in-service colleagues who may not have the time that we have to be more active. So let me see if there's anything I'm leaving out here. You will receive, once you're officially retired, you will receive a letter from me detailing some of these ideas, and also providing you with the different links to the different websites that you can use. And I guess I will close by saying that this is a very exciting time in your life, and should be a very exciting time. But it's also an overwhelming time. And I wasn't on all of I didn't participate in all of hear all of the speakers today, but I could just tell, it's one PowerPoint after another, and it's one, topic after another, and it's one option after another, and another decision you have to make. And will I make the right decision, and how will I make it, and who will I call? But your union is there for you. We are really lucky to have the PSC at our backs, and in particular to have a retiree chapter that is actually part of the larger union. That is not so for some of the other city unions. So I look forward to welcoming you to the chapter. I took a quick scan through the names of people who are on this Zoom today. I recognized a few names, people I worked with way back when. But most of you, I don't know, and look forward to getting to know you and working with you and having fun with you as you move into this new phase of your life. So that's basically what I have to say. I'm happy to take questions if there are, or I see Felicia's beautiful face on the screen. So I guess.
And there are no questions on the queue right now. So.
Okay, thank you, Sandra. So let's hear a wrap up from our wonderful treasurer, Felicia.
Right.
Thank you, Anne. So we've come to the end of our session, and I would like to thank all of our presenters, Sandra, Tallin, Patrick, Debbie, and also Anne, who just gave a great presentation on the Retirees chapter. I can tell you the Retirees chapter is a very active chapter, and they're always at our events and demonstrations, and whatever campaign we have, they're there. I've met so many retirees. I also go to their meetings as well. I know I'm not a retiree, but they have great presentations and great topics. And I want to thank you all for coming today to the PSC Spring Pre-Retirement Conference. I hope that you leave today with essential information. As I said in the beginning, you should not procrastinate when you're planning for retirement. And as Anne said, you may come to one or more of these sessions because there were a lot of slides and a lot of stuff to take in. So I want to thank you and thank the presenters, and have a great day. And please review the information that we gave to you today. I know it's a lot. Take your time, as Debbie says, take your time. So thank you, everyone, and have a great day. Again, if you came late, my name is Felicia Wharton, and I'm the treasurer of the PSC. Thank you.